Hello, Professor Phillips. This is Jamie Koehler here, and I'm here to do my 5-minute video presentation on a communication between a healthcare provider and a patient. And after some careful thought, got lots of examples being in dentistry for 18 years or so, but I've decided to take a different route and share something that I personally experienced as a patient. And so here we go. So I had spine surgery 5 years ago, and I'm going to discuss my post-operative 6-week appointment visit. And to give you a little background here, I was going into this appointment in extreme pain, which wasn't expected, and I had gone back to work in hygiene after just 1 week after surgery because this particular surgeon told me that I could. Meanwhile, I never got a take-home instruction sheet on what things not to do and to do, so I was trying to navigate that. 1 week after going back to work seemed to prove probably the worst thing I could have ever done, and I was in just as much pain as prior, but it was new kind of pain, and it was as if I was my whole upper extremities. I had a C5, C6 fusion. You can kind of see the little scar there, and it was almost like I was just constantly being electrocuted. And so I come into this appointment and desperate for this appointment, looking forward to it. The doctor comes in and he greets me, "Hi, Jamie, how's everything going?" And so I immediately go into explaining everything I had been experiencing, and it didn't take long for me to see that his nonverbal communication showed annoyance, and he rolled his eyes. So that didn't demonstrate any empathy or interest in what I was going through. And by cutting me off, he wasn't exploring my perspective. And there definitely wasn't a connection established, that's for sure. The environment was cold and uncomfortable. And obviously there was no finesse in this situation. So he cuts me off and he proceeds to go into justifying his procedure and the work that he did. And this kind of caught me off guard because in no way was I thinking that he had done something wrong during the procedure. I just needed help with my symptoms, and I wanted out of pain, and I wanted to figure out what the problem was. And, I put my life in his hands and I expected him to help me. And so he goes into saying that, well, my situation, this is unusual that this is happening. This has never happened. And so then I'm starting to become more concerned. And by the end of the appointment, he tells me that he changes his tune and tells me he's actually not surprised that this has happened. And quote unquote tells me that my symptoms are merely the result of my anxious personality. And at this point in the appointment, I shut down. I am completely shocked in what he had just said to me, to have such a lack of finesse and empathy and care. Didn't want to maybe try to collaborate with me and let's see if we can get this figured out. So I left that appointment, and he did prescribe me a nerve medication to help with the symptoms. Thank goodness it did help. So he did do that, but I left there completely devastated and I felt abandoned. And so this definitely affected me mentally and emotionally. I never went back for any follow-up cares after that. So because of the lack of communication or being treated this way, I didn't follow up with my care. And fast forward, just to give you a little bit more of this story, I was diagnosed with an autoimmune disease almost a year to the day later, and they think that this manifested as a result of surgery, which I guess is not uncommon. And so, had better communication occurred during this appointment, had he listened to me, had he wanted to explore further, we could have been able to make this diagnosis a whole year sooner and be able to get the appropriate treatment. So it just goes to show one of the most important things we can do as healthcare providers the communication. So even though he was an extremely intelligent surgeon, and I'm sure his work was done to perfection, without this being able to communicate appropriately with a patient, this can have detrimental effects on their health. So yes, so there's my story, and thank you for listening.